Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance. In this week's episode, we discuss music for mental health, a blood test for Alzheimer's disease, devices for seniors, and COVID-19 antibody testing. Let's wrap things up. This is episode 34 for the week of May 25th. I'm Matt Moneypenny.
And I'm Alex Ross.
Before we get started, our diagnosis code of the week is W17.3, fall into empty swimming pool.
Right. So, interestingly enough...
Has this happened to you before?
Yes.
What a coincidence.
This has happened to me. Though, I'm going to surprise you here. It's not related to my current challenge of finding some exercise that works for me. Because when I went to the public pool and I saw it was empty this time, I did not jump in, okay? I didn't. But a few years ago, I spearheaded a movement to change the color that they paint the inside of the pool, okay?
Yes.
Because I went to the local community pool. I was all ready, got up on the diving board, and jumped right on in because it was beautiful and blue. Apparently that's just the color they paint it, and the water is not clear. It wasn't there. So, yeah, it has actually happened to me, but I won't fall for that again.
Yeah, I don't think, you got to be more careful, dude. I feel like half the time, I don't know what you have time for in your life other than just getting diagnosed with these codes, but,
Yeah, and paying insurance bills.
Yeah, exactly. It's you've got an expensive life. You live a lavish life of hospital bills.
Yeah, come to think of it, though, maybe that's what they were meaning by the closed sign on the gate.
Most likely. And with that, let's get right into the news. First up, we have now playing Mental Health Awareness, the musical. Music streaming company Spotify teamed up with the leading mental health charity Calm for a week's worth of content for Mental Health Awareness Week, which was May 18th through May 24th. The new campaign included original playlist and podcast content. One effort is the Wake Up, Wind Down podcast, which had exclusive content about mental health awareness throughout the week. Through the collaboration, Calm wanted to provide relief through audio, while also opening up the conversation about mental health and reminding people that they're available to help. Calm's free and confidential helpline and web chat are available from 5 p.m. to midnight every day to provide practical, anonymous, and non-judgmental support and advice.
Well, I really like the idea of this effort.
Yeah.
I guess the challenge I have, and I don't know, maybe I haven't identified myself in the right way for Spotify, but I use Spotify to listen to music, right. And I had no idea this was going on.
Yeah, I had no idea either. Maybe their advertisements are so targeted that if you don't have Calm or listen to sad music, then you're not going to get this advertisement. So
I definitely listen to some sad music occasionally.
I'm sure that Spotify has such targeted ads because they probably have all of their entire customer base profiled down based upon all the music types they listen to, that they could probably just reconstruct what you look like as a human being.
Yeah, at this point, probably. But I don't know. I think I could have enjoyed some good music to wake up to. Yeah. I usually set one of my alarms to be a Spotify playlist. So if I would have known about this, maybe I would have set the Wake playlist.
Yeah. And Calm is like one of the more popular mental health and meditation apps. So it's cool. It's cool to see big apps come together for the greater good of mental health awareness, Right.
It's very cool, but I think it would have been cooler. I think it would have been cooler if I would have known about it.
That's fair. That's fair.
Next up, hoping to pass this memory test. Researchers have made advances towards being able to diagnose Alzheimer's disease through a single blood test. The test they developed measures the concentration of a protein in blood plasma associated with brain changes in Alzheimer's. They found that the blood test could accurately detect which patients had Alzheimer's, which were healthy, and which had a different type of dementia caused by a neurodegenerative disease. Right now, doctors typically diagnose the disease using a series of tests designed to rule out other causes, but that process is time-consuming and costly. The researchers are now aiming to refine the tests in hopes that it will make it easier to detect Alzheimer's at an early stage when it can be easier to treat.
Alzheimer's is one of those diseases where it's kind of like, it kind of confuses us. It's something that just feels like it's never going to be treatable, but clearly these kind of tests and stuff are starting to prove that wrong. It just requires more medical research.
Right, and hopefully in the future we're going to get better at detecting it earlier, because that seems to be the biggest thing with Alzheimer's is how early do you catch it, and how much can you slow down the progression to really,
that would be huge, especially because if they detect it soon enough, then maybe it's just a matter of doing some memory testing, every day. Spend an hour or so testing your memory and just doing some exercises there, and maybe that'll be enough to combat the further development of this disease. So who knows? But
I'm obviously not a doctor, so I can't say. Really, I'm not terribly well versed in the mechanics of Alzheimer's or its progression, and I'm thankful that I'm not, right? Because I haven't had to deal with a loved one or work with individuals who are suffering from Alzheimer's. So I'm thankful for that in one sense, but also it means that I really don't know what I'm talking about in terms of what happens with Alzheimer's. But when does this become kind of a routine type of diagnosis? Not a routine diagnosis, but like a routine test, right? Because if we can detect Alzheimer's now, and we can detect it really early, are we able to detect it before we start noticing the symptoms? Maybe there's some symptoms there, but we go, they're just getting old, right?
Yeah, right.
We don't need
to.
Who
knows,
So
man?
Do we start administering this test at, let's say, 65 and just always test for it and see what we can find?
Yeah, it could be like a thing of
that'd be cool.
It becomes like the prostate check almost. Males have to just get that done. And if you don't, you're opening yourself up to a lot of risk, and maybe this is kind of going to go down the same route eventually. Who knows? Well, only time will tell.
Well, we could just do that with every potentially preventable disease.
It's true.
Or major diseases that could act quickly and cause a lot of damage.
It's true.
Just
it's not
have
a bad
a
idea.
day.
It might take forever, but it's not a bad idea. You
every
turn 65.
Every 10 years, 40th birthday, 50th birthday, 60th birthday. It's like a regiment of things that you have to do, kind of like how...
Your entire year consists of just being in a doctor's office, getting tested for different preventable diseases that are coming towards you down the line, potentially.
Right. And it's kind of like when you're first born, and you have a series of vaccinations and whatnot that you have to get, at your 1 year, at your year and a half, at your 2 years, kind of like that. But on the other end of the spectrum.
Right. Next up, does anybody out there want this test? Antibody at all? Last Monday, New York began its free COVID-19 antibody testing for healthcare workers and first responders. It was supposed to begin in the beginning of May, but just became available last week. Testing is voluntary, but it's part of a large study to learn more on how to better fight the disease. The city plans to test 140,000 healthcare workers and first responders for 4 weeks. This is part of a city initiative to test 280,000 New Yorkers for antibodies through June. I mean, it was supposed to happen early May, but if it happened last week, then it was mid-May, so it's really not that delayed. So that's pretty good. I mean, they're kind of staying on the time track right here. So
right. Yeah, they've been doing antibody testing with a lot of the different major cities, and finding somewhat surprisingly that there was a much higher rate of infection than we previously thought.
Yeah.
Which, on one hand, is kind of concerning because it spread a lot faster and a lot wider than we knew. But on the other hand, it also drives down your mortality percentage because there were more people who had the disease compared to the same number of deaths, right?
Right. Yeah, a lot of people still firmly believe that the conspiracy theory that most of us already had it in February, January, because a lot of people seem to be out with the flu-like symptoms. So,
well, it's tough to say, right? Because these antibody tests suggest that a lot of people have had the disease at some point, and we don't really know exactly when that was, right? But we do know that there were confirmed cases, for example, in Ohio, as early as February.
Right.
Because the disease existed then, and we could theoretically test for it.
It'll be really interesting to see, like, the final timeline of the disease, like 5-10 years from now, when they're like, okay, this is patient 0, and since patient 0, it only took 2 weeks for it to reach the entire world. Like, that would be crazy.
I want to see the accurate numbers,
right?
And they go through it and kind of figure out how they're going to make it happen. Because some things, for example, the way we count our normal flu season, the flu season isn't being counted the same way because a lot of the cases are potentially being counted as COVID-19.
Right.
And so in the end, we're going to have to go back through and be like, wait a minute, was this? Should we count that? And figure out what the accurate number should actually be. And we can't do that until we get out of the whole thing. So I'm interested to see which direction that goes. Hopefully, though, it seems we're kind of on the downward slope now, at least in Ohio and surrounding areas. So
there is an end in sight. No one would have thought of it, but it's coming.
I just have to replan my entire summer vacation.
But I swear, if I hear one more commercial of a company telling us that we're all in this together and that these are troubling times, I swear to God.
Seriously, though, all the commercials are the same. You could just take out the
literally
company
the
name
same.
And swap them around, and they'd all work.
It's insane. Like, it's just like, I get it, okay? I don't want to buy your product. I don't want to use my stimulus check to boost your company. I want to use your my stimulus check to buy food and survive.
I was thinking a year's supply of Lucky Charms marshmallows. That's what
yeah, right? Oh my goodness.
Just remember, during these uncertain times, we're together, but apart.
It's
we're
like
alone, but still together.
You know those old commercials for Lucky Charms where it's like, they're after me, Lucky Charms? It's like, no, you're after me, stimulus check. Exactly. Leave me alone.
Next up, tech connecting with seniors. A senior citizen center in Wyoming partnered with Design Your Tech Solutions to keep seniors connected and learning. Tech Connect is a program that provides seniors with devices like iPads and smartphones so that they can stay connected with friends, loved ones, and even healthcare providers. The program gives instructions on how to use the devices. People in the community are able to donate old or unused devices to the center.
Yeah, I mean,
I hope they've got a helpline set up because I'm imagining it now. How do I get rid of this notification?
Yeah, exactly. They open up the camera app. How do I close the camera? Or they want to open up the camera app and they're like, how do I open the camera app? I always find it funny. I'm going to kind of go on a tangent here, but I always find it funny whenever, you go to dinner with like a family, like a whole family or a whole event, and someone wants to take a picture, and for whatever reason, it always seems that the person who's the less tech savvy in the entire group is the one who gets the camera on the phone, and then somehow they close the camera app and then are just walking around aimlessly asking people how to open up the camera.
Exactly.
But to bring it back, I mean, yeah, as you can see, technology is starting to get more and more into healthcare, and senior citizens, just because they're senior citizens in healthcare doesn't mean that these tech barriers aren't going to be broken at some point. Also, Design Your Tech Solutions, huh? Wow, interesting name. Okay, moving on.
Great name.
With that, let's go to our next segment. BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches. Welcome to Breach Patrol. We talk about the latest and greatest healthcare breaches and cybersecurity breaches all across the world. This is not industry specific. First up, we have still not paying this toll. The Australian transport company Toll Group is facing its second data breach of the year. The cyber attack involved ransomware, which resulted in the company to shut down its IT systems to, quote, mitigate the risk of further infection. Toll Group has refused to engage with the attackers' ransom demands. The investigation found that attackers have access to at least one server which contains information of past and present employees and details of commercial agreements with past and present customers. Toll Group is not aware that any information has been published, and the data is not readily accessible through conventional online platforms. However, the attacker who stole the data is known to publish information on the dark web.
I was quietly laughing to myself because I obviously don't like tolls. I see this as a heroic act, not a criminal one.
Yeah, seriously. Now who's paying the toll, huh? No.
Right.
What's interesting here is that they have the customer information. Now, obviously, since it's a toll group, it's pretty much anyone who uses a toll, which in turn is probably everybody in the entire country of Australia at some point. But what is also interesting here is that it's a ransomware attack, and as we know, that ransomware has become more and more popular as a goal to make money fast for hackers. The reason why that is because they shut down your system. It's usually not that hard to shut down someone's system because a lot of people don't have the safeguards for technology implemented. Thus, they get in, they block you out, and you have to pay in order to get your system back. A lot of times, they don't even care about the information that's in the system itself. They just want the money, right? They're holding you to ransom. So that's pretty much what that is. And this is a good example of that. So
next up, need a lawyer for that stolen data? A hacker group stole 756 gigabytes of data from one of the top U.S. celebrity law firms, Grubman, Shire, Marcellus, and Sachs. The group doubled its ransom to $42 million and is threatening to leak information until the ransom is paid. One cybersecurity firm said the hackers' cache includes contracts, non-disclosure agreements, phone numbers, email addresses, and private correspondence. Grubman is refusing to negotiate with the hackers because they might release the documents even if he pays the ransom. The FBI advised Grubman not to pay because even when enormous ransoms have been paid, the criminals often leak the data anyway.
Yeah, another ransomware attack. This is a big week for ransomware.
Absolutely.
What I find interesting before we even get into the story is I feel like there's a lot of official companies out there that has and Sachs at the end of their name, you know? It's not like, it's like that old, what's it called? It's like that old telephone book trick where you put ABC Company or ABC Limousine or ABC Technology Company because then you'll be on the first list of the telephone book. I just find that funny.
I don't think this one has quite the same
it might.
effect, though, in the telephone book world. Just quick point of clarification. U.S. celebrity law firm. Is the law firm the celebrity, or do they represent celebrities?
I think they represent celebrities.
Okay, so in that case, there's probably some pretty high-profile people in here who don't want you to know they signed an NDA regarding specific things.
It's true. It's true. Could be some dirty things coming out from this if they leak it. So, but it is interesting. They're kind of like, okay, so if they leak the celebrity information, right, we're gonna have blowback, and it could potentially ruin us as a celebrity law firm for the foreseeable future. However, the FBI, who is the organization, the government organization and body that kind of helps people out with ransomware attacks and hacking, advises not to pay the ransom.
Right. Because if you negotiate with terrorists, then they just keep coming back?
I guess. Yeah, I guess. Although there has been cases when people pay the ransom and they get it back. So it's like, you really never know when it happens. I also want to point out
if they're serious.
Yeah, right. I also want to make a point that I read a story recently that said a lot of times the FBI will hire hackers, right? They'll hire past hackers because clearly they know something that the FBI doesn't. So they'll pay them a good amount of salary and the hackers will go after other hackers. The problem with that is, and they've been running into this a lot more frequently, is the FBI has an old law in place that says that if you have smoked marijuana within the past 2 years, they cannot hire you, right? So, how a lot of hackers partake in smoking marijuana, so the FBI has had issues hiring those hackers that have breached systems because of that law. So I just find that funny.
Oh, maybe we'll see a change in laws just for the hackers.
Maybe.
Just so that we can, enforce our cybersecurity a little bit better. Wouldn't that be interesting if that was the thing that got us to
Yeah, they're like, we need to legalize marijuana so that we can hire hackers, damn it.
Right.
Next up, could a speeding ticket cost you your data? Personal data of 129 million car owners in Moscow, Russia is being sold on the dark web. The seller leaked a sample of the dump to help prospective buyers verify the validity. The sample has car makes, models, place of registration, and dates of the first and last registration. But the buyer would get more details such as car owners' full names, physical addresses, passport name numbers, dates of birth, and contact information. A car-sharing company found some of its cars in the sample and confirmed the validity of the published data. Recently, there were reports about citizen information for sale on the dark web, which appeared to derive from violation fines issued in Moscow. This indicates that the police have suffered an undisclosed or undiscovered data breach. It could also have been a breach from the online payment forums where citizens pay their fines rather than a breach from the direct police database itself.
I think it's pretty obvious that the people behind this particular attack were looking for data to sell.
Yes.
I mean, I'm imagining all the spam phone calls I get already that are telling me that my car warranty has expired. Except now they're going to be able to call and say, hey, your specific car, this year, make, model, the warranty is expired.
With
and I'm going to
number.
assume that it's actually whoever calling me, like my car company, because they know all that information. So that's potentially very dangerous. I could see it being used for some extortion, like, hey, you didn't pay your parking ticket. And you're thinking, yes, I did. I paid that parking ticket. But they insist, we never received your payment, so you better pay us or you're going to jail.
Right. They could even send you mail. They could do anything, really, with that data.
Right.
I mean,
that's some potentially very valuable data to the right organization that wants to use it in some malicious way.
Right.
And that's it for this week's wrap-up of your weekly healthcare news. I'm Alex Ross.
And I'm Matt Moneypenny.
And we'll see you next week. Thank you for joining us for this week's episode of The Bandage. This week's episode was written and produced by eTactics. eTactics is a leading revenue cycle solutions organization committed to providing innovative, web-based solutions that improve our clients' cash management and customer relationships. Thanks, and we'll see you next week.